Hello, ladies and gentlemen. This is Dr. Deepak Koshal, Chairman of Hriday Shala, Heritage India Heart and Endovascular Group, Chandigarh, India. Right from my journey from my MBBS days in IG Medical College, Shimla, Medical College, JN Medical College, Belgaum, and fellowship invasive cardiology from Indraprastha Apollo Hospitals, Delhi, followed by joining as a visiting consultant in cardiology in Indraprastha Apollo Hospital, Delhi, working in Dr. RML Hospital, Delhi, Sir Gangaram, and Saket City, now Max Smart Saket, Delhi, and various other institutions, including the neighboring SAARC countries and doing a lot of innovative interventional cardiology procedures in African nation also. I'm just here to let you all know a little bit about heart disease. So, ladies and gentlemen, regarding our cooking, the monounsaturated oils like olive oil, then canola oil, mustard oil, and groundnut are very good, and so are the polyunsaturated like soya bean and sunflower oils for cooking. And we should try to use minimal oil while cooking because they are calories. If one is obese, overweight, then one must use less oil during cooking. Very important. And omega-3 fatty acids, fish oil is also good. If we have to eat meat, let it be fish and lean chicken. Red meat comparatively is harmful for the heart, and meat, if taken, should be cooked properly. Green vegetables and fruit are really the best. We should have at least 3 to 5 times a day, fruits and vegetables both, and the colored ones are better. They have more things in them which are protective and raise our immunity. And of course, all fruit. I mean, this will help not only otherwise, even during the corona times. And you must learn to pray, meditate. We are all one. We are all brothers and sisters all across the world. We shouldn't have hatred or malice towards anyone. We must learn how to help each other, each family in distress, each person in distress. If we find any addicts somewhere, try to help them. We have to break the chain of the drug supply across the world. Very, very important, ladies and gentlemen, if we can. And that we can't do without the help of the cops, the investigative agencies, the governments. Very, very important all across the world. They are destroying our families. And regarding corona, please wear a mask in public. Even when you go out, meet your friends, it is a matter of a few months, hopefully. Corona is causing deaths, but then there are so many other diseases which are causing hundreds of times more deaths than coronavirus, ladies and gentlemen. So human beings, we all have that much strength that we'll overcome this corona factor also. So we must do all these things what I told you. Again, a recap. Before the recap, I'll just tell you the treatment of heart disease. Treatment of heart disease is usually medicines. Most of the people, if they suffer from a heart attack, coronary artery disease that is, I'm mainly concerned about coronary artery disease today. Most of the patients recover with medicines alone and lifestyle changes and healthy eating, food habits, quitting of smoking, controlling the blood sugar, decreasing your stress level, controlling your weight. Most of the heart patients, 80 to 85% of them get cured by this only. There are 15 to 20% patients who do require immediate angiography followed by stenting of the blocked arteries and open heart surgery We have various kinds of open heart surgeries, beating heart surgery, and minimal invasive surgery also. Nowadays, the doctors all over the world are doing it, and the surgeons are excellent nowadays. The patient is discharged in 5 to 7 days, even lesser in minimal operative surgeries. Stenting, the patient goes back home in 1 or 2 days. And also, people who have continue having problems or are treatable with medicines, if with some exertion you have chest pain or heaviness, there are treatments like enhanced external counter pulsation, EECP, and ESMR. They are really excellent, and most of the people, probably I'll also have a dose of ESMR and EECP myself, let the doctor decide, but most of the doctors do not advise EECP. I don't know why. It's amazing, when it pumps the arteries from your the blood from your the arteries of and veins of your leg into the arteries of the heart and the brain. Of course, some patients you cannot do EECP, that is different, but this is an excellent thing which is coming up nowadays, and US FDA approved also for that matter. Even ESMR is another treatment of heart disease without open heart surgery or stenting. And these treatments can help the patients who have undergone stenting and open heart surgery also. These treatments open up collateral channels. Tiny arteries are opened up along the blocked arteries, so the heart continues to pump because it continues getting oxygen. So in a recap, ladies and gentlemen, cheer up, life is beautiful. All over the world, not only in India, all over the world, we are one. We are one huge big family. Let us not be divided by religions. Religions are all man-made by us, number one. We all should be sensible to help and mature to help each other, each person in distress. Let no one sleep hungry. Let us be happy. Let love flow across the world. And let there be no heart disease, no other diseases. Let us pray for each other. Let us wish the best for each other. Thank you so much, ladies and gentlemen.